Let's talk a little bit about the reconstruction now. The reconstruction didn't happen straight away in your case, it was discussed later. How did the topic come about?
It was discussed to start off with actually when I saw the breast surgeon who did my mastectomy, because I wanted reconstructive surgery, but after my mastectomy I had to wait 14 months for the actual surgery.
So there was a 14-month gap between the mastectomy and the reconstruction.
That's right, yeah.
Which is quite a long time.
Well, I had to have radiotherapy in between times, so that meant I couldn't have an immediate reconstruction with my mastectomy. I had to wait.
A factor of that long wait is sometimes that you began to adjust and cope with your own body, like post-mastectomy, and you might question whether the reconstruction is really warranted after that amount of time.
I did get used to the mastectomy because I looked at myself most every day to see what I looked like, and after a while you do get used to the way that I got used to the way that I looked. I saw the mastectomy as essential surgery. I had no choice.
Was that intentional, to look at your own body on a regular basis?
Yes.
Because some people use that as a technique to reduce the fear of seeing the scar and the change in their body. You know, if you're quite phobic about it, it's tempting not to look. But a treatment for that is actually to have that gradual exposure of looking regularly, to desensitize.
That's why I did it, yes.
Yeah.
I thought the more I looked at it, the more it would be me, and then I'd stop noticing it, which is true.
And it worked that way, did it?
I think it did work that way, yes. Yeah. Because by the time it came up to talk about having the reconstructive surgery, or maybe it was just last minute fears, I thought, it's not essential surgery, isn't it tempting fate to do this, really?
And you were saying then, after getting used to it, you perhaps had second thoughts, was it, about the...
Only briefly, which again I was able to discuss. I do remember discussing that.
Yeah. So you were able to discuss it, and then finally you decided, yeah, you did want to go ahead with it. So what did the reconstruction involve in terms of the procedure? How many days out of work and out of role?
Well, I had LD surgery, back flap surgery. So they moved muscle from back round to the front and took skin from my back. I was in hospital for a week, and I was off work for, I can't remember now, 6 weeks, maybe a little bit longer, but I think it was a bit longer. I actually, 2 weeks after my surgery, fell all the way downstairs, so that didn't really help.
No.
I was very tired after surgery. It hurt. I was very weak.
Yeah.
But it was worth it.
Would the workplace reasonably understanding about the second period of time off?
Very, yes.
They were supportive?
Yes. Well, because of where I work, it's a large organisation. It's disability sick leave that I have now because it was cancer. So, yeah, it was fine.
Yeah. After the reconstruction, you had to relearn your body again.
I did. Part of the reason I had the reconstruction was I wanted to wear a normal bra again. Something nice and lacy.
Yeah.
Not that I'd ever worn anything like that before, lacy, but I couldn't because of the implants that I had. I had expanding implants. Expanding, that might sound like they're going to explode. Expander implants, where they can you have little ports each side, so you can inject more saline into them.
You can adjust them.
To adjust them. And over time, I thought I didn't like my scars on my body, because you do have quite a few scars. I have scars all across my back, a scar all across my back, and an elliptical scar across the front with the skin is added in from my back, and also a mole from my back, which I never had obviously there before. It was quite a novelty, looking down and seeing something that you'd not really noticed before. But when I saw the plastic surgeons, they asked me how it was, and I said I didn't want to sound ungrateful because I was very happy with what they'd done, because it's what they do is brilliant surgery. But I said I got some little issues. There was puckering, sort of in my cleavage area.
Yes.
And maybe from the front on, it didn't look so bad, but of course when you look down at yourself, it looks worse. Also, I could feel all the edges of the implant. So if I touched myself, I could feel where it was. And also there was a slight sloshing sensation. So I mentioned that to the plastic surgeons and they were like, oh, that's not a problem. We can just swap them over. You've got to have the ports out, so swap them over.
What do they mean?
Put a different implant in.
I see.
So instead of the implants that I had, they put in normal, softer implants.
Yeah. And did that get rid of the other issues?
It got rid of the puckering.
Yeah.
I can't feel the edges of them.
Yeah.
There's no sloshing. And also, I don't see the scars anymore.
And was it a fairly straightforward procedure, the second one?
It is a straightforward procedure, although the operation took a couple of hours and I was off work for a few weeks.
Yeah.
But yes, it's straightforward.
And are you glad you had that done?
Very glad I had that done.
So if you hadn't mentioned it, they perhaps wouldn't have gone for that?
They might not have done, I don't know. But I'm very glad it was done.
Now we're in 2014 now. When was the date that you had the second operation?
2013.
And how's your recovery and rehabilitation period been since then? You know, how have you found getting back to normal after that final operation?
Well, it's fine because it was at the end of October, and then in January I started doing yoga again. And I hadn't done that since before I was diagnosed.
And that's a good sign to be able to go and start it again.
Yes.
Did you notice any limitation in your body?
Only very slight. It's not worth worrying about.
And what about just by being inactive for that period before? Was it?
I had done some Pilates at home.
Yeah.
Which helped, I think, to strengthen certain parts of my body. But it feels good to exercise again because it's made me not only fitter but happier.
And that's a tip for everyone, that by doing an activity, particularly physical activity, it actually can help.
I think so, yes. It's made me much happier.
Along similar lines, have you started anything else as a hobby or interest that's come fairly new since your cancer diagnosis?
That's a trick question that I'm supposed to know the answer to, but no.
You haven't? No, there's been no... The Pilates is the main one.
Yoga.
Yoga.
I did Pilates at home.
And
because
then,
obviously after the mastectomy you're quite weak, so I got a machine that helped to strengthen strengthen my body.
Was that your own idea?
That was my own idea, because I didn't know what else to do.
Yeah.
And I didn't want to go out to classes at that point.
Yeah.
So I got that. But I do yoga 4 times a week, so it doesn't leave an awful lot of time for anything else.
It's pretty intense. Have you noticed your body getting stronger over time?
Yes. Stronger and more flexible. It's quite good actually after 3 years nearly to take control of my body again.
Yeah. I'm wondering, thinking out loud, whether it's such a good activity post-surgery that we could recommend specifically yoga for anyone who's in a kind of rehabilitation phase after a major operation.
Yeah, I think it helps not only that you increase your flexibility, which is quite important after you've had a lot of surgery. You can take it at your own level.
Yeah.
You do what you're able to do. So it makes you physically better, but also mentally better because I'm calmer, I think.
Yeah.
And I think generally, after all the cancer anyway, if I think of myself before I was diagnosed and now, I am happier and I am calmer.
Yeah. There's a lot of positives that can come from it.
Yes, I think so.